Good afternoon, everyone. Good afternoon. Thank you so much for joining us on today. Our culminating event for our African American History Month celebration and acknowledgement. I am Regina Berry, the moderator for this particular session. And it is now 12 o'clock and we are about to get started. So once again, thank you to everyone who has joined. And I want to send a presumptuous thank you to everyone who is going to join so I don't have to do this housekeeping thing again. All right, we have with us on today Dr. Danielle Henderson as well as Dr. LaMar Hasbrouck. I am going to start this off by reading their bios so that you know who these renowned individuals are that are joining us and why we have them for today. So taking it in order of chivalry, of course, we'll first start with Dr. Henderson. So Dr. Henderson earned her PhD in clinical psychology from the University of Louisville. She completed both her pre-doctoral clinical internship and postdoctoral fellowship at Indiana University School of Medicine. Her postdoctoral fellowship in clinical health psychology emphasized cardiac pulmonary behavioral medicine. In October 2018, she began her clinical track faculty position in the Department of Psychiatry at Indiana University School of Medicine, and she was recently appointed Assistant Dean for Diversity Affairs in IU School of Medicine's Faculty Affairs, Professional Development, and Diversity. Dr. Henderson works as a clinician and supervisor in a variety of clinical settings at IU School of Medicine and IU Health, including the Advanced Pain Therapies Clinic, Integrated Care, and the Adult Outpatient Psychiatry Clinic. She is the co-principal investigator for 2 studies supported by the Racial Justice Research Fund at Indiana University, Purdue University, Indianapolis. Ooey pooey. One project aims to examine the impact of discriminatory law enforcement exposure and childhood trauma on physical and mental health and quality of life in adult Black men and women in a primary care setting. The other project aims to examine an intervention for school children following lead exposure. Dr. Henderson is committed to diversity work. She brings this passion to her role as a member of the IU School of Medicine Psychology Internship Program's Executive Committee, spearheading diversity efforts. Additionally, she co-chairs the Department of Psychiatry's Diversity, Equity, and Inclusion Committee and the Indiana Psychological Association's Diversity, Equity, and Inclusion Committee. Ladies and gentlemen, Dr. Henderson. Our next presenter, of course, is Dr. Lamar Hasbro. Let me start off by saying he is an author. I want to make sure I do not forget that because he has offered to give us a couple of signed volumes of his book. So I want to make sure I promote this book so that we can get our autographed copies. So his book is Naked Musings of a Disease Detective, COVID Bites. For his bio, Dr. Hasbrouck, a renowned public health leader, is a physician executive and CDC trained medical epidemiologist. He was previously the Illinois State Health Director and Executive Director for the Association of the nation's 3,000 local health departments. During his 25-year career, he has been on the front line of many outbreaks, including swine flu, MERS, and Ebola, both in the US and abroad. A national voice during the pandemic, he has been a CNN contributor, featured columnist, and subject matter expert for USA Today, Chicago Tribune, The Hill, The Grill, Vox, and others. Ladies and gentlemen, I present to you Dr. Lamar Hasbro. Before our speakers get started, I want to make sure I do this housekeeping thing. So to our presenters, as well as to our participants, on behalf of our Board of Commissioners, which are very, very committed to diversity and the diversity world, on behalf of every department head, as well as our executive director, and then the staff, of course, as well, we want to welcome our presenters, and we want to thank everyone on this line, both district employees as well as outside. We want to thank you so much for being here with us on this day to cover our COVID-19 roundtable and its impact, of course, on the African American community, given that this is Black History Month. So we're going to start with Dr. Hasbrouck. Dr. Hasbrouck, if you could just give us kind of an overview for COVID-19, this pandemic, how you see it, and where we can even go from here.
Okay, thank you so much, Dr. Berry, and it's great to join Dr. Henderson on this panel today. Thank you for thinking about me. So, I mean, I don't have any real words of wisdom other than say it's been taxing on all of us. Much of the impact, especially on the African American and other communities of color, could have been lessened, and across the entire nation. There's a lot of issues and circumstances that could have been avoided had we had, I would say, more capable leadership in charge, and had we been really more proactive about this. I think we wasted a lot of time. In fact, I know, because I've been tracking this from the very beginning and writing about it, is we sat on our hands for probably about a good 3 months before we even really moved from a stage of denial to a stage of really kind of recognizing it, to say nothing of really being prepared for it and actually doing the things that we needed to do. I think the biggest failure in all of this, you can't control the virus itself from coming here, given that, an outbreak, anywhere is a threatened outbreak everywhere because of the way we travel and things nowadays. But I think that in terms of the readiness and the preparation for folks, in particular communities of color, there just could have been a lot more done in terms of forewarning and preparation. I mean, we know, for instance, that that Americans don't like vaccinations. We know very well, from decades of data, that only about 50% of Americans even avail themselves to the flu vaccine every year. When it comes to young people and people of color, it's more like 35%. So this whole idea of vaccine and vaccination hesitancy is not a new one. We know what populations are hesitant in general. We know about the history of African Americans in this country and some of the circumstances there leading to hesitancy and healthy suspicion. So we could have done better in preparing folks who we know are more vulnerable and are going to be less likely to get vaccinated. And I like to use the analogy of kind of a movie trailer. Whenever Denzel has a new movie coming out, for instance, we don't find out about it the day before the opening. There's months, 3, 6, 5 months of trailers and other things and, talk shows and promotions. You get ready, you get geared up for the movie. So by the time it hits the theaters, you're expected and ready to go and be prepared for that movie. Well, in this case, we kind of saw this movie before with a number of other outbreaks and epidemics and pandemics, and yet we didn't do any of the warning. So I think it was a huge communication failure, and that's what really put us kind of behind the 8 ball and kind of flat-footed. And lastly, I'll say that in terms of any public health emergency, public health crisis, public health urgency, it's so important, especially for our community, to apply what I call the MQ. That's the 3 M's. So it's really about the message. That message has to be culturally appropriate. That message has to be sent early and often. It's about the messenger, So you have to have credible folks from the community that the community can really trust and understand. And then you have to have, last thing you have to have is the medium, that is using the vehicles and the means of communication that African Americans, other folks actually use to get their news, if it's urban radio or other things, social media. So you got to have the message, the messenger, and the media. And we really didn't have that lined up going into this pandemic. And so as a result, it was much, much worse than it had to be.
Dr. Hasbrouck, thank you so much for that. In line with that, Dr. Henderson, if you don't mind, I do have a question for you.
Yes.
How has mental health been impacted for African American people? Have we seen an increase in African Americans seeking therapy since the beginning of this pandemic?
Yes, so mental health has really been impacting African Americans, I think, prior to the pandemic, well before the pandemic, but definitely with the pandemic, we've been seeing kind of a lot of different things going on at the same time. So a lot of people experiencing anxiety, depression, trauma, general life stress, intimate partner violence, caregiver responsibilities, concerns about employment, finances, grief, coping with suicide of family or loved ones, or learning of suicide of people in the community. So just a lot of different things that have been impacting the mental health of African Americans. And again, I think all at the same time during this pandemic time. I know in early 2021, I think around January, February, the CDC did a survey and found that around the time of the survey, I think about 45% of Black Americans were endorsing symptoms of anxiety and depression. However, about only 19% of those individuals had taken prescription medications for mental health concerns or received any sort of counseling over that last month. And then I think about 12% felt like they needed therapy or counseling, but did not seek those services. So seeing there a high need of care, but for different reasons, maybe not receiving that care.
Wow. Thank you so much for that. Before we move on in our questions, I want to make sure I stress to the audience that while we have already some questions set to ask the panelists, should you have any, please put them in the chat. And if time permits, we will also be trying to address those questions as well. So with that said, Dr. Hasbrouck, I want to come back to you for a sec.
Yes.
We're 2 years into this pandemic. Where does the African American community stand when it comes to accessing public health services in general and the COVID-19 vaccine? And then, if I could add on to that, some states, including Illinois, are beginning to lift mask mandates. What are your thoughts about this? Is it too soon? Are we out of the woods yet? Should we be erring on the side of caution? What say you?
Okay, those are some power-packed questions there, Regina. So let's see, let's take them in this order. In terms of being out of the woods, let's just start there, because this has been 2 years too long. And I'm sure everybody's looking for the, the all green, the green light in terms of moving back to the old normal. So there will be no old normal. Let me just, cut to the chase on that. We're gonna forever in the future, I believe, proceeding with caution in terms of mask wearing and some of the other things. And when it comes to mask wearing, I look at it like this. There's really three groups. There are the folks who see value in a mask. A mask is just a barrier. That's all it is. Much like, let's use the condom analogy. Okay, a condom is not 100% protective, but if you get it fitted, if you wear it properly, and if you wear it consistently, you will, through that barrier method, protect yourself. A mask is similar. in the sense that we know that science says it's about a 50% or so protection. It protects you from others. It protects others from you. Needs to be fitted, needs to be worn consistently, and that barrier will help you. But that said, there's three groups of people. There's the folks who see value in that, and they're going to wear the mask regardless, even if the mask mandate is lifted. Okay. Then you got the folks who aren't going to wear it, okay, because they see no value in it. They value their, personal freedoms or whatever the case might be. So they're never going to wear it, and they haven't been wearing it all along. And then you have the folks in the middle who are kind of like, depending on what's what. So this lifting of the mask mandate, rather, and mandate I say in quotes because, if it's not enforceable and if it's not being enforced and penalized, it's not really much of a mandate. It's more of a strong recommendation. But really what you're talking about is that small segment in the middle who might say, well, I was going to wear it, but now I don't have to wear it, that kind of thing. Other than that, everybody's going to continue doing what they've been doing. So I think the mask mandate is really kind of a, negligible in terms of, risk for folks, or in terms of changing behavior. Now, in terms of if we're out of the woods or not, this is what I can say. We're never out of the woods with a virus that is constantly shape-shifting. The whole variants and the whole genetic mutations, which is basically just to say the virus changes with pressures from the environment, and it changes in certain ways that in some cases that virus can be a little bit more infectious, a little bit more transmittable, maybe a little bit more dangerous. But most importantly, it can be resistant to the vaccines that are out in circulation. So that's always going to be the case going forward. So we're never quite out of the woods, but what I will say is that at this point in time, we've never had so many Americans, Blacks included, be more protected. So have some sense of immunity. Sometimes that immunity lasts for a number of months, 6 months, 9 months, we don't know. Science is out on that. But at this point in time, I think probably about 65% of all Americans have been fully vaccinated. About 90+% of seniors have been fully vaccinated. It does, again, much like the condom or the mask, it's not 100% guaranteed, but it will give you protection. So we've really reached a level of population immunity where I think that the worst days are behind us. And so I feel confident in saying that. The other piece that you asked, I think the last piece maybe, and let me know if I'm missing anything, was in terms of access for Blacks to public health resources and the like. So one good news is that over time, in the Chicago Urban League and others have done a great job in some of the national polls, Kaiser Foundation, and looking at the issue of vaccine hesitancy. Again, it's nothing new for our population. Happens with the flu. It happens with a lot of things. I got conspiracy theorists in my family, and they got it all figured out. We just don't like vaccinations. So the good news is that over time, with some experience, and with folks seeing that, their nose isn't falling off and their arms aren't falling off, we got more and more people getting vaccinated. And so the vaccine hesitancy rate has really gone down in the Black community, and the vaccination rate has really gone up. So that's good because it gives you protection if you believe in the vaccine as protection, as I do as a public health scientist and a physician. So that's good. In terms of accessibility to public health services, and let's say health services in general, that's increasing because even though we've known that the health equity issues have been a problem, we've known that Blacks are the least healthy among Americans, and we've known that there's been access issues and health literacy issues and all kinds of issues that put us at disadvantage. This has been kind of another wake-up call for us, the COVID epidemic or pandemic, to say we need to really funnel resources, money, education to these communities. We need to target them, and a lot of that is happening. And so I think that we're in better stead now than we were before the pandemic in terms of our awareness about these services, and about the services really awareness in making targeted attempts to reach African Americans and other people of color.
Awesome. I will say I am seeing more of these facilities available now in my neighborhood than, I saw at the beginning of the pandemic, which is good. And it's funny that you mentioned that the conspiracy theorists in the family
That's right.
Because I was one. I waited. And my son often teased me because I wait and say, I want to see what's going to happen with everybody else. And so a year after the vaccine, came out, he said, my son calls me Toots. Private thing, of course, but he says, Toots, you've seen everybody now. All of our neighbors got the vaccine. No one has grown a third arm out of the middle of their forehead, and nobody's falling out walking down the street. So what say you now? So
Yeah.
it does take some waiting, some seeing, what will be the real effects sometimes. And I will say, of the people that I know, and I happen to know a broad spectrum of people, it isn't just the African American community that's afraid of the vaccine. It isn't limited to us. But with that said, Dr. Henderson, I'd like to come to you for a minute.
Yes.
So, how does the following affect mental health care among African Americans during this pandemic? Racism, poverty, suspiciousness, that whole theory that we have that they're up to something. Is this the Tuskegee experiment? Is this a new gynecologist experiment? The things that we've experienced as a community. And so therefore we are afraid to necessarily be so trusting. And then it's free. And in our community, we've never known anything good to be free. So you're going to give me this for free too? Come on now. We pay more for everything. Now all of a sudden this is free. So that, as well as the stigma in our community regarding, mental health, the lack of information that's available, as Dr. Hasbrouck talked about, from what directions are we really getting the information, and is it reliable? And then, of course, incarceration and trauma surrounding, the mental health, while we are yet as a community dealing with this pandemic and the high numbers of both deaths and hospitalizations for COVID-19 in our communities.
No, I think this is a really, really important question. So as I've been thinking about my answer, kind of the way I was breaking things down, again, thinking about with mental health. So to start with the first point you mentioned, racism, I think what I've been seeing and what I've been reading and kind of learning is that it's, for a lot of people, it's been a reason to initiate mental health care or to desire to initiate mental health care. However, there's also been a concern about doing that because of concerns about the provider's lack of understanding about racism, what that means, how that potentially impacts someone's life. So I think, again, people are kind of in this position where I would love to go and talk to a therapist about it. However, will they understand? Will they truly get it? With poverty, I think, again, that's definitely a big barrier to people being able to establish quality mental health care or establish mental health care altogether, and definitely something that impacts, access. You were saying suspiciousness of providers. I think, again, that's another piece that is a barrier to care because, again, just with the history of African Americans in this country, we've not always had the best experiences with medical or mental health providers. And so, again, that question of who is taking care of me, what will that dynamic be like in the room with me? And then I think also some people are really concerned about what is that person doing outside of the room, because we know that is impacting their care, whether some people realize that or not. You had mentioned, stigma. That's another huge one, particularly when we think about mental health care in our community. Some people, grow up in environments and families where mental health is not discussed at all. Mental health is viewed as something that, there should be no problems with that if you are doing, quote unquote, the right things to take care of yourself. Or if you are experiencing, mental health concerns, again, some people have viewed that as a personal flaw or deficit. And so it can be very difficult in our community to, one, I think, acknowledge with one's own self that there might be some, mental health concerns there, and then to actually voice that to people to potentially get the help that you need. So again, a big barrier to that care. And then with incarceration, people with mental health difficulties are overrepresented in our nation's jails and prisons. I think I was looking online, one estimate is about 2 in 5 people who are incarcerated have some sort of history of mental health concerns. And that's twice the prevalence of mental health concerns within the overall adult population. And despite different mandates from courts, there's still a significant lack of access of adequate mental health care in incarcerated settings. So again, a huge population there that's in need of help and not getting the appropriate help that they need. So I think, again, in trauma, I was just remembering that with trauma. Again, I think I've seen that as a reason people are wanting to come in to therapy, to talk about traumatic experiences they've had, to talk about racial trauma, which I think, again, in my field, people are starting to talk a little bit more about. The lifetime prevalence rate of post-traumatic stress disorder is highest among Black Americans at 8.7%. So again, we're a population that has experienced trauma in a variety of ways. And I think something that makes it kind of complex from the mental health standpoint is right now, the manual we use to help us diagnose the different mental health disorders doesn't allow us to necessarily take in or count, if you will, racial trauma as an experience or something that could contribute to PTSD. And so again, going back to the type of provider you're working with, that provider's understanding of how the way we may be going about asking questions about a trauma history could cause us to miss how racial trauma is contributing to this person's life, appropriate, assessments and measures. Again, yeah, we could be missing that and, not providing the key treatment that people are in need of at this time. I hope I addressed all of your points there.
You did a great job of it, and I thank you for that. As I was listening to you, I thought about my own experience. I'm a heart patient. And so initially when I started seeking care, not knowing what was happening with me, I was being misdiagnosed with pneumonia or, just basically being blown off. And it wasn't until I had to be rushed into the hospital having, a heart attack and my life, hanging in the balance, that then someone finally did the necessary tests just to hook up an EKG machine to me to see that there was some trauma happening with my heart. And then I had to be rushed, of course, into emergency open heart surgery. And I think about, and I have insurance. I have good insurance. So I think about that in terms of people who don't necessarily have the insurance that will put them in these spaces where informed individuals are, to give them proper care from the beginning. And the dismissal that unfortunately African Americans seem to encounter in the wellness spaces, to be able to have someone fully hear them out for what is happening and then run all of the necessary tests to be able to properly evaluate what the situation is so that we can indeed receive proper care. So with that said, let's talk about these wellness spaces. If both of you can address this a bit for me. Wellness spaces seem to be dominated by the majority culture. Can you recommend some apps or wellness spaces that cater to African Americans? And why do you think we need these different spaces?
Okay, that's a good one. Well, let me start my comments by saying this. There is obviously a lot of historical trauma faced by us as Black immigrants, descendants of slaves. And that goes without saying. But I'll tell you, in 1985, it was really the first documented study. It's called the Heckler Report, some 35 plus years ago, where Department of Health and Human Services looked at minority health for the first time, and found that there were 60,000 excess deaths among Blacks, for instance. That's 60,000 people that died that wouldn't have died had our rates been equal to those of the white population. So that was one. That was just only 37 years ago or so. The other Sentinel report that I'd like to reference is the IOM, the Institute of Medicine report called Unequal Treatment. That was just 2001. And what that showed, to your point, Dr. Berry, is that the treatment that we do get, when we do get into the corridors of medicine or health or the hospitals, is not equal. It's unequal. It's very biased care. And so, you know, they looked at rates in heart disease, rates in different procedures to diagnose heart disease, managing pain, et cetera, right across the board. Blacks were treated differently and usually given less care. So it's not only enough to have a health insurance card and to make your way into the doctor, but when you get there, you got to worry if you're going to get the standard of care that everybody else would get. And so that makes it all the more important to shop around to get the doctor that matches you. That's that culturally appropriate for you, that understands your language, that you feel comfortable asking questions to, you know, often, you know, we have a lot of stigma around mental health in our community, but just health in general. You know, you're sitting across from a doctor, you don't want to seem like you're not listening, you don't want to seem like you're uneducated, you don't want to seem like you're asking too many questions. And so you just yes, and you leave and don't really understand how to take your medicine. You miss a dose, you take 2 doses the next time, et cetera, and you get into all kind of trouble because you don't really have that, what we call health literacy, which doesn't speak to your intelligence. It's just your ability to really understand medical leaves and the instructions, to be comfortable with the care plan and to really take an active role in your care plan. So, you know, healthy and well spaces begins with you taking some responsibility for your own health and understanding that you're the driver of your own health. Yes, you want to go to a physician, healthcare professional, mental health expert, et cetera. Their job is really to help diagnose you, give you information, give you suggestions based on, you know, the literature and their experience and things like that. Your job, on the other hand, is to really be able to understand those, to kind of weed through them, to pick the best option for you that you're going to be adherent with, even compliant with, and work as a team with your professional. And so too often we go into the doc and we're like, okay, fix me. You know, I'm broken. You know, I need a tune up. You know, what we gonna do? You know, and it's not, you know, it's we got it flipped upside down. So those are some of the things. Start with a professional that you feel comfortable with. If you're assigned someone or you end up with someone that you don't have a good fit, don't be afraid to make that change and get someone that you do, you know, mesh with, because it's a team. You know, taking care of you and ultimately your family, your community is really a team approach, and it requires some proactivity on your part. So start with that, being comfortable, ask the question that you need, and then continue to, you know, to do the things that you know that you should be doing. And often many of us know what we should be doing. It's just we choose for one reason or another, circumstances, priorities, not to do them. So those are some of the things that I think will help us on our way. Then lastly, I'll say, we have to understand where health happens. Health does not happen in the hospital, in the clinic, and in the ER. It's not where health happens. That's where tune-up happens. That's when getting fixed up happens, like a car, right? You only take your car to the mechanic for maintenance and to repair something. But if you're out in the community driving your car and driving over bumps and speed bumps and that's where the wear and tear happens. So we have to understand that health happens in the community. And so those we call them social determinants of health. There's behavioral determinants of health, medical determinants of health, all the things that are in our universe, so to speak, really determine how healthy we're going to be. A lot of the habits that we have control over, the eating, the smoking, the drinking, the sleeping, the stress management, those types of things. So there's a lot more that we have control over than we realize it. And so I think it takes an activated person to really shepherd their own care.
And so from a mental health kind of perspective, thinking about one question I get a lot is, how do I find a provider? And like Dr. Hasbrouck was already saying, really thinking about, what factors are important for my mental health provider to have. I know for a lot of us, having that race, ethnicity match is important. Language is another big one. Age comes up a lot, veteran status, life experience. So really thinking about those things that are important to you that your therapist have. And then sometimes the hard part then is then finding someone. Maybe some people are already familiar with this, but Dr. Joy has Therapy for Black Girls, which has a podcast and then also has a website that has a directory of Black female providers throughout the country, where you can put in where you live, and then it brings up a list of providers who are licensed in your area. That's a really nice place to find providers. There's also Black Men Heal. I think similarly has a directory that you can look up based on where you live, find a provider. And I think they also have an opportunity for maybe up to 8 sessions for free with a provider. Taraji P. Henson has her Boris Henson Foundation in honor of her father. Again, I think you can apply to get maybe some funding or linked up with a mental health provider at a reduced cost. I also encourage people to think about, maybe psychology training programs in their area. For us to be able to progress in our programs, we have to, see so many client hours or accrue so many client hours. And a lot of times places like that will have PhD students who are able to see clients on a sliding scale. We're, supervised by licensed psychologists. And I think, again, you can get quality care there. As far as like other wellness spaces, I recently learned of these two, and I've been sharing them with people. There's a website called Yoga Green Book. So yoga, green as in the color, and book. And so it's kind of named after the motorist guide, the Green Book, that was used in, I think, the 30s and early 60s. And so again, this is a website. I think you can find places to practice yoga. I think the yoga places are owned by Black people or people of color, because I know in the physical spaces, that's a place that comes up where sometimes we're not invited, we're not welcomed, or we don't feel safe in these places. So I was really excited to learn about that, the Yoga Green Book. And then there's also another website called the Outdoor Afro. Similarly, if you are a person who really enjoys nature, hikes, skiing, I think, again, you can go on the website and look up these different activities and kind of find maybe people in your area or where you're maybe planning to travel to who are interested in these types of things as well. And so you can link up with your community to engage in these fun activities outdoors. But I think, again, getting back to that last question, having these spaces where we might need different spaces. I think a lot of it, like I was saying, boils down to feeling safe, feeling invited, feeling welcomed, seeing yourself in these spaces, and also having other aspects of the space that relate to you. I was in a meeting this weekend and someone was talking about music played, at certain gyms. I think a lot of us are open to a lot of different types of music, but sometimes when we're getting our workout on, there's a particular type of music or kind of groove that we like to be in. And in certain spaces, we might not hear that. So I think, all of those things together make it really important for us to have our space where we feel safe practicing our wellness and health.
Wow, you both did awesome with that question. And I thank you so much for the answers you provided. They led to some other things for me. And I will say, much to the point of Dr. Hasbrouck, that, we do have to have some ownership in our health and understand that we own our health. And I think that is a missing ingredient for the African American community, because we were not historically given permission to own our health, first and foremost, and then secondly, inherently knowledgeable about how to do that. I will say for myself, at the time when it happened, I was very educated. I held a master's degree. I was 43 years old, very clean living, non-drinker, non-smoker. Who would have expected any of these things to come my way? But it led to the point that he mentioned about stress and stress management, because we know that stress is higher for the African American community than any other. So I thank you so much, Dr. Henderson, for those places that you gave. I actually found myself writing them down. Therapy for the Black girls, I want some Black girl magic. I need this thing to work. And I want to make sure that I am able to manage my stress, because that is the thing that almost killed me, was the stress. We know that stress is higher for African Americans, both in community living, on jobs. It just gets to be a little bit more severe for us. It's traumatic. And so to that stress management, I do have a question for you. What are some stress relieving exercises that can be incorporated into our daily living? And is there anything other than the ones that you gave that is culturally Black? And that's for both of you. And I'm sorry, I use the Black term because that is what I was given in this question. I am one who embraces the African American term. I don't like to represent myself as devoid of color. However, I do want to make sure that people are comfortable and do understand why I am using the terms I'm using.
Dr. Hasbrouck, do you want to go first?
No, you got it.
Okay, okay. So the way, again, as I've been thinking about this a lot over the last couple of years, kind of breaking things down into a couple of different kind of categories here. So thinking about, there are many different ways that we can engage in relieving stress. So, one example is thinking about things you can do mind and body. Examples of those would be deep breathing. So that's often something that I do in session with my patients. We take our breathing for granted and just kind of go about our days and never really do any check-ins. And so taking a few moments to check in with your breathing, see kind of like what the rate is, and do some exercises to help you slow down your breathing. Also, I think, deep breathing exercises are great for what we call like mindfulness practice or present moment focus. Really just in these few minutes, all I'm going to do is just focus on my breathing. What does it feel like, as my breath, is leaving my lips, as the, air is hitting my nostrils, and what does it feel like as I, start to expand my lungs, checking in on those things. As you were talking about with stress, we often carry stress in our body. And so another great exercise for that is called progressive muscle relaxation. So basically with that, you're going through different parts of your body and intentionally making muscles in those areas tense, and then releasing that tension and feeling the difference in those sensations. And so what you can do moving forward is then kind of check in, as I'm sitting at my computer, where are my shoulders right now? Are they up, by my ears? Or if they are, okay, let me take a moment to just bring them down. How are my hands? Am I sitting in this meeting, with clenched fists, or are my hands nice and relaxed on my lap? That's a great one. Also, I have to say that sometimes disconnecting and avoiding our feelings can be helpful. Of course, we don't want to do that necessarily long-term, but there is helpfulness in kind of numbing out for a little bit, because there is so much that goes on. Then thinking about, self-care. I'm sure a lot of people have heard about that and a push for that. So that's basically, what is something that I'm doing for me? Often, rest, or maybe, finding a nice outfit, or, something that I'm doing for me. And then also the idea of collective care. So what, is maybe a way that I can help take care of other people, or do a type of care with other people. That can also be, or those options can also be great stress relievers. And then soul care. I've been really reflecting more on this, that's basically, things that you can do that like transcend the mind body, and remind ourselves, to connect to something greater. So again, with busyness of life and when we're stressed, we can often avoid or run away from quiet moments. And so with soul care, we're giving ourselves some quiet time and some space to really tune in to ourselves, also tune in to, a higher power or our spiritual power, and really listen to the messages that are coming up for us. Because I think, we can often distract or ignore those really important messages that can, clue us in as to if something is of concern or if something needs to be addressed within us, and help us moving forward in our community. And then as far as, things that are maybe, like you said, culturally Black, dancing is a big one, moving your body in some way. There are videos, there are classes that you can move your body. Singing is another big one. And then also, drumming, of course, thinking about our African roots, drumming is really big. So if there are opportunities to engage in drumming, either in a group or just on your own, those are some great ideas that I had as well.
Excellent. I don't have much to, that's very comprehensive. What I will say is that it's important for those folks that especially for those who are caring for others, to make sure you take a pause and care for the caregiver. Because oftentimes if we have kids and, folks are at home schooling and this, that, and the other, I think the tension and the stress level can be escalated. And so we have to just kind of pause and make sure we're doing whatever it is we choose to do to de-escalate our stress, to make sure we're taking care of the caregivers, because if we don't take care of ourselves, we're not going to be very much used to others. So that's just a piece that I think is worth reminding folks about.
Great, thank you. And our last question: are there any major future concerns for African American individuals that have been affected by COVID? Are there any specific health concerns that the African American community are more, I'm sorry, let me try that question again. Are there any specific health concerns the African American community needs to be aware of at being more at risk if they have had COVID as a community?
I will take a first crack at this one. So I think that one of the things that all people, including Black folks, should be aware of is that once you've had COVID, I wish we could hit the raise your hand if you had COVID, because I actually was fully vaccinated, boosted, and then got COVID. Thankfully it was without symptoms. But I think that what happens is we don't sometimes do our own due diligence. And so I remember when COVID first hit, there was a lot of urban legends, Black folks don't get COVID because we got melanin or we got this or we got that. And I was like, okay, here we go. No due diligence, the know-it-ologists out there got it all figured out. And that's a problem. So what I would say is, in terms of one thing that we should be aware of is, there's a condition called long haulers. These are the long-standing symptoms that can happen once you've had COVID. Typically, it happens with folks who have more of a mild or severe level of COVID, where they're very sick, or in some cases they have to be hospitalized for a short time. But there can be lasting symptoms and things that can happen. It can be brain fog. It can be things around, your taste or your smell. It can be things around your kidneys. I have family members had some kidney damage that's going to be long-standing. So as a result, heart damage, lung scarring and damage there, things with your nervous system. So they call them long haulers. We can't really predict who's going to get that. But oftentimes, and we don't know, we've only been living with COVID, for a couple of years. So we don't know how long it's going to last. There's a lot of trials and a lot of studies looking at how to care for folks with these conditions, and just really trying to map it out. But the point is that if you've had COVID and you end up having one of these long haul symptoms, now you have a pre-existing condition. And so what that means is that you're not at your base level of health. Which means that if and when the next pandemic hits, or if and when the next illness hits, your health might be compromised. And so again, under the auspices of due diligence, you must, even if if you had diagnosed COVID and you're having some things, some symptoms and some lasting things that are happening with you that happen after COVID, you need to, again, reach out to a healthcare provider, make sure this is documented, because that might put you in a higher risk group for not only the next infectious outbreak, but also the next chronic disease outbreak, et cetera. And I'm sure folks will remember when we started vaccinating folks, we did them in waves, starting with our seniors and then the first responders, and then those folks with pre-existing conditions. Well, we now have a new pre-existing condition. And I'm talking about hundreds of thousands of people are in this category now. So that's something that I think Black folk need to be aware of and just need to look out for.
And I don't have much more to add with that from a mental health perspective, other than, thinking about, if you've experienced COVID, I would even say, even if maybe it was a mild case, being diagnosed with something like that is really serious and can be really scary. So you might also notice, increased anxiety, depression, again, thinking about maybe if you did have to stay in the hospital, if you were in the ICU, that could be a very traumatic experience for some. And so I think just, checking in on how you're feeling as you're trying to, kind of adjust to life post-COVID, and checking in on mental health as well, because those things could be coming up.
Awesome. Thank you both. 8 minutes. Okay. I want to say first and foremost, I really, really appreciate both of you being here. And I said it at the beginning. I must say it again. I am really proud of the work that you both do, not just for our community, but for the nation at large. Because at the end of the day, anything that affects any community affects the whole. And so we have to make sure that we are both cognizant and proactive to ensure that we are taking care of everything and everyone around us in the way that we are able to take care of, to ensure that we are all whole and healthy going forward. I meant to mention this at the beginning, that I myself I'm honored to be able to do this roundtable. I am actually dedicating it to the memory of my niece, who this month last year passed from COVID. And it was a difficult blow for my family. So I am honored to be able to do this now and get information out, which unfortunately Patricia did not get. So because she didn't, she ended up in the hospital a little too late. And unfortunately, we now mourn her instead of celebrate her. So I hope for those who are listening to this, that are on this line, that you are able to take in this information, that you pass it on. Any information more that you need, please make sure you look it up. The CDC has done an excellent job of actually looking at racial disparity, or what they call health inequity, when it comes to our communities. So they want to make sure that we are getting this information and how the disparities are happening in these communities of color. So it's real important. Morehouse and HBCU did a great job also of this health equity tracking to be able to show. So for those who maybe don't trust the CDC, but you will trust an HBCU, Morehouse did it as well. So with that, I want to make sure also, before I give the floor back to the two of you for your closing words, and Dr. Hasbrouck, I would really love if you talked about your book in your closing words, but I want to make sure that I thank Sheila Porter, who actually recommended Dr. Lamar Hasbrouck. Sheila's been on our African American History Committee for 7 years now. And so when we needed someone, I turned to her and said, hey, do you know anybody who can do this? And she immediately gave up Dr. Hasbrouck, and it was a perfect match. And then, of course, I have to thank my own son. Thank you so much, Richard, who recommended Dr. Henderson for me because I was looking for a mental health professional. So I want to thank both of those people for putting these panelists here at the table with us. I want to be sure that I thank our board as well as our executive director and all the employees. And now I turn it over to the two of you, and you can decide who goes first for your closing remarks.
Dr. Henderson.
I can go first because I know I'm interested. Yeah, I don't want to come after a book promotion, so I'll go first. No, this has just been an honor to be part of this. I love doing these types of presentations and talks. And again, from a mental health perspective, I just try to stress, help is available. Please don't let barriers or challenges get in the way of you getting, the quality help that you need and deserve. And just again, for our community, as best as we can, not shying away from maybe some difficult conversations about mental health, intentional check-ins on people, readying yourself for whatever response might come, and informing yourself of resources in the community. So there are, national organizations, National Association, I think Mental Illness, NAMI, has a website and a text line, a crisis line. So many available. I don't want to leave anything out. So please don't wait to get the help if you need it.
Great. And so what I'll say in my closing is it's okay to be one of those that kind of want to wait and watch. I did that, and I've been doing this for decades, physician, epidemiologist, and all the rest. And I was one of those that let's wait and see. So I waited about 4 or 5 months before I got vaccinated. And as I told you, vaccinated, boosted, and still got infected. So what the message I'll say is that science is not perfect. It's evolving. And I wish we had done a better job communicating that at the onset to let folks know to anticipate the guidance is going to be changing as the science changes. And so you're saying, oh, they told us not to wear masks. Now they're telling us to wear masks, told us to stay in. Now we can go out. This is because the science is evolving. This is new for all of us. And so sometimes just disclosing that in humility and saying, yes, I'm a scientist. Yes, I study this, but we don't know the answers is the best answer. So I'll reinforce, do your due diligence. Don't be a know-it-ologist, but get yourself educated, and try to make the best informed decisions for yourself. And listen, if you don't want to get vaccinated for whatever reason, that's okay too. Do the things that you do feel comfortable with doing. If it's social distancing, if it's wearing a mask, if it's boosting your immune system with vitamin C and, making sure you get your rest and sleep and decrease your stress, those types of things. Do the things that you can do to help protect you and your family and your neighbor if you'd like. So that's what I'll say about that in terms of closing. And then lastly, in terms of the book, it's called COVID Bites, Naked Musings of a Disease Detective, because I was a disease detective for CDC for some years. And basically what it does is, in common folk speak, I basically take you through the evolution of the first year and the first 500,000 deaths of the COVID pandemic. And so it's real-time posting. I did a series on LinkedIn and, I had a lot of engagement, over 100,000 folks. And what I did over the course of the first year, I posted probably about 130, 150 very short blogs, because LinkedIn only gives you 200 words and 1,300 characters. And I took the 100 top ones and I put them in a book. And each book has each chapter has an introduction. I kind of take you through the 4 seasons of, winter, spring, summer, fall, et cetera, and give you commentary. And so as I say to folks, it won't make you an epidemiologist, but it'll give you insight as to how an epidemiologist thinks. And having been on the front lines of many outbreaks and pandemics and planning and reacting and doing, vaccine campaigns and things, I think it's a very clever and witty read. It's not dry at all. It's just kind of from the top of my dome. What are we doing and why are we doing this and not doing that? And then what are the repercussions of things? I talk about chicken soup for the soul. I talk about, holiday gatherings. I talk about mental health and alienation and being lonely. I talk about, celebrities that got infected and what that meant and how some of them were really good role models and some of them were really bad role models. I talk about the guidance and, and the pomposity of the president and some of the missed opportunities in communication, things like that. So it's a pretty interesting read. And so obviously I'd recommend it for folks. I thank you for the opportunity for having me. I stand as a resource if you need me.
So again, let me thank all of you for being here. I want to thank these presenters. You both were absolutely awesome. Kudos to you. I said to them before, and I'll say it again in front of this audience, I and the ancestors are very much pleased. Thank you so very much. See you, everybody. Thanks again for being here.